Hilary is here. I'm not going to ask you about vitamin boosts, but the Health Secretary is announcing today what she has billed for the last few weeks as a big boost to the National Health Service. And I wondered, below the headlines, have you actually seen what's going to change?
Yes. What's hoping to change. The ABCD, as you know, is there to tackle ambulance problems, the backlog. It's there to tackle the problems in social care and the problem of recruitment and retention of doctors and dentists. So if we could just do all that like that, everything would be marvellous. Unfortunately, it's impossible. It's like turning a tanker around in a canal. Can't be done, certainly not overnight. I looked at some of the detail and to me it's a bit disappointing. For example, improving telephone systems in general practice so that, you know, we use some sort of cloud technology where people can get through to the GP practice more easily. There'll be more telephone lines available to make your appointment. My question is, who's answering those phones? You've got the same number of GPs, same number of reception staff. You can have as many lines as you like, but if there's nobody to answer, it doesn't really help the patient. Currently, 85% of appointments happen within 2 weeks, which is still far too long. 44% on the same day if it's critical. But in my day, we would see somebody every day if they needed to be seen. And so the goalposts have changed dramatically in recent years. And the reason for that, because we simply don't have enough doctors and nurses. We have 130,000 vacancies across the NHS. 10% of the workforce is missing. But for every one GP that has retired early because they can't stand the heat in the kitchen anymore, that's 2,000 patients on their list who haven't got a GP. So 2,000 times 2,000, 4 million people who have been put on other GPs' lists, and that's why GPs are struggling.
And there's no suggestion in this announcement that there's going to be any more money for more GPs?
No more money for... Nothing mentioned about recruitment and retention of GPs, which is essential. No more talk about money for care or how doctors are going to provide, GPs are going to provide extra staff for their practice. It has to come out of the GP existing budget. Well, there is no money in the GP existing budget. That's been cut over the years. So it's a great idea to have a physiotherapist on site, a diabetic or an asthmatic nurse specialist on site. That would take some pressure off the GP seeing acute serious illness. But who's paying for these staff? They're already on a shoestring budget. So it's a bit pie in the sky.
And A was for ambulances. We've had on this programme many times conversations, lots of tweets and emails from people saying how hard it is to get an ambulance, the queues with ambulances outside A&E departments because there aren't enough beds in A&E to admit people from the ambulances.
That's right.
Does it look as though there's anything to deal with that issue today?
I haven't seen anything. What they have asked for is 1 million volunteers, the people who helped during the pandemic, who came back to the NHS or who retrained to do vaccinations. But what are these 1 million volunteers going to do? There is always going to be a clinical responsibility. I mean, I can see them doing voluntary driving if they've got a licence to do that, but I can't see them taking blood or admitting patients or diagnosing. That's just not going to happen. And yes, it's a great idea to incorporate pharmacists and get more pharmacists to help out. But what does a pharmacist do when someone comes back for the second time with their headache? They say, go and see your GP, because it could be something more serious than a tension headache. It might be the first sign of a brain tumour or something more serious. So the bottom line is you can't shortcut the number of GPs that you need. We need to produce more. We were promised more in 2015. They never arrived. In fact, we're 2,000 short of that than we were then. So this is now a crisis which we must address if the NHS is to be saved.
Absolutely. I mean, Jackie, we know that you have many hats these days, and one of them is working for a trust and seeing this front up. Does that make sense? Because, all the promises sound great. The detail is concerning. I mean, she's quoted as saying she's promised to direct a laser-like focus on patients' needs. What does that mean?
Well, I mean, and that is good. But Hilary is absolutely right. What patients need, actually, is they need more doctors and more nurses to be able to treat them more quickly. And, of course, the problem is, if you can't get an appointment with your GP, and I completely agree with Hilary, targets have a role to play, but you can't measure something better. You've got to ensure that the people are there to deliver it. If you can't get a GP appointment, what do? You go to the emergency department. That's why in the hospitals that I'm responsible for, we've seen big increases in the numbers of people coming to our emergency departments, far too many people waiting far too long, and not enough people being able to be discharged from hospital when they're medically well because of all the problems around social care. Those are the really big issues that need to be dealt with by Thérèse Coffey.
And indeed, of course, the national insurance hike was supposed to be to help support the delays from the pandemic and deliver on social care, wasn't it, Quentin? So that's taking money away from doing that, which is a concern.
It's such an enormous, unwieldy bureaucracy, the NHS, that it strikes me it's almost impossible to achieve anything quick, any quick remedy to it. I will be looking at today's announcement as a parliamentary sketch writer, so to me it's a parliamentary event. We've had a few of these over the years, you know. Politicians come along, say big things about the NHS, and nothing ever seems to happen. It's a bit like the way that in the 1970s British Leyland would stick a new badge, a Vanden Plas badge, on an Austin princess, and nothing really happened.
I'm sorry.
I'm very sceptical. I'm very sceptical, Jackie, about politicians talking up big changes in the NHS, because little ever
15 years ago, most people were getting through A&E in less than 4 hours. 15 years ago, most people were getting their diagnostics within 6 weeks. They were seeing cancer specialists within 2 weeks, and nobody was waiting the lengths of time that people are waiting now. So it is possible to make a difference in the NHS. And just on this point about massive bureaucracy,
I'm still sceptical.
The NHS is one of the...
I'm still sceptical, I'm sorry.
The NHS...
I sat through lots of Alan Milburn reorganisations.
And I just told you what the result of Alan Milburn reorganisations were. Well, people waiting less time.
I'm not sure that was universally everyone's experience.
Well, it was... Well, I'm afraid that is what all the figures showed, and that is what the history of the NHS showed as well.
One thing, though, that seems odd is with this new plan, which seems very focused on GPs, the Royal Society of GPs says nobody has talked to them about it. Neither Thérèse Coffey nor the department. They say we haven't been consulted on it. So that in itself seems strange.
If they did talk to GPs, one of the things, I mean, agreeing with Quentin for a moment, he's saying there's too much bureaucracy. Already in this plan, there's more bureaucracy. They want to have information for patients. They can compare what their appointment and waiting times are like compared to other GP practices. What is the point of comparing a practice that works in, say, Bournemouth, where you have a very elderly population, to an inner-city practice where you have lots of younger people? I can tell you right now that more people will die within 10 years of registering in Bournemouth than they will in an inner-city just because of their age.
It is
so straightforward.
Hilary,
what's the point of the bureaucracy?
What would you do? I know that you believe, you said it many times, and I suspect you're right, we need more GPs. We need those vacancies in the NHS filled, and we need some sensible way of funding social care to free up hospitals and allow things to work better in the system. But what would you do other than just putting more money into it? Because that will make people think, well, we haven't got that money.
Well, you've got to make the job of general practice and nursing more attractive again. We got rid of nursing bursaries.
How would you do
that? Well, you produce residential homes where nurses can get their accommodation subsidised.
Okay.
So they're not already in debt, and nor are junior doctors in debt by the time they qualify. I mean, there are nurses going to food banks right now, taking payday loans. They can't feed their families. That cannot be right, doing such a wonderful and responsible job, which they've proved during the pandemic. You know, they can go and earn more money at the checkout in the supermarket than looking after people's lives. We've got to look at the values that we have in our society, and we've got to pay nurses and junior doctors more. Otherwise, they're not going to want to do the job. They've got to look after their families.
OK, I mean, I wanted to talk to you about this motor neurone disease thing, but should we pick that up? Should we pick that up another time?
Let's do it another time. It's a very promising story, but we can do that another time.
It's a very important breakthrough. OK, we'll have a chat at 7:30. You're coming back then.
Let's do that.
All right, brilliant.